Hello everyone, Dr. Alex Vasquez here, and today's presentation is titled Integrating Functional and Naturopathic Medicine Concepts and Therapeutics into Medical Practice for Common Primary Care and Specialty Conditions. I'll touch upon some key concepts and paradigm shifts in clinical care which I believe have taken place over the last 15 to 20 years. I'll start with an introduction, of course. I'll discuss some of the clinical paradigms, and I'll also contrast those clinical paradigms so you can see the advantages and disadvantages of each of those. Then I'll provide an introduction to a protocol that can be used from a functional medicine and naturopathic medicine model for the understanding, management, and treatment of inflammatory conditions. I'll divide those conditions into metabolic inflammation, allergic inflammation, autoimmune inflammation, and also neuroinflammation, including the concept of the gut-brain axis. I think you'll find this work relevant for your life if you are a clinician, researcher, teacher, or if you simply inhabit and maintain a human body. I think this protocol will show you some of the major checkpoints that we need to attend in order to optimize health and prevent disease. Also, if you have any friends or family who may have any of the conditions I discuss in this presentation, I'm sure you'll find the presentation then all the more relevant. Some of the limitations that apply to this presentation include the fact that this is a single presentation of approximately 1 to 1.5 hours, and so that won't provide me a lot of opportunity to go into deep detail as I would if this were a graduate course or extended, let's say, weekend seminar. But within the constraint of 60 to 90 minutes, I'd like to provide you an overview and an intellectual template that you can use for the understanding, study, and management of these clinical conditions. The two major themes of this presentation include starting with an introduction that includes an analysis of different clinical paradigms, and ultimately the bulk of my time is going to be spent again on a clinical protocol using some examples of how to implement that protocol clinically and how you can use it as a model to study other conditions as well. So anytime we're learning new information, we may have to discard old information, and anytime we're learning a new paradigm, we need to appreciate how that new paradigm contrasts with an old paradigm and see what we might use and what we might need to discard. Again, I'm your host for this presentation, Dr. Alex Vasquez. I'm a doctor of chiropractic, doctor of naturopathic medicine, and doctor of osteopathic medicine from the United States. Also, several other accomplishments are listed here, including some of my clinical experiences, teaching experiences, also editing, writing at least 25 books, and also writing at least 100 articles in various scientific and specialty journals and professional magazines. You can see some of those locations where I've published my work listed here. And I've also not only worked within 3 or 4 different professions, but I've also lived within different cultures and on 3 different continents, including in the United States, Latin America, and Europe. This page provides an overview of some of my copyrights, disclosures, trademarks, etc. Anytime I talk about dosages within this presentation, I'm talking about dosages for adults who are not lactating, not pregnant, and who do not have kidney or renal disease. Each of my slides, of course, is going to have a title at the top and a little bit of information here in the corner. Then I'll have an index to the left-hand side to kind of provide some orientation. Then the bulk of the information will be, of course, in the center of the slide. When I need to provide a summary, I'll do that within a mauve or purple-colored text box like this. And then you'll see the use of certain images from my books, such as Inflammation Mastery and another book I'll discuss later called Brain Inflammation. Again, the 2 major themes of this presentation are, number 1, to discuss the medical paradigm and contrast that with functional medicine and naturopathic medicine. And then I'm going to spend the most of the time of today's presentation discussing a clinical protocol, certain clinical examples, and how to implement that protocol in clinical practice. And as I state here in the highlighted box, learning new information within a new model requires that we first create some space for that new information. If people are rigidly adherent to the medical paradigm, then the mind is not open to a new way of seeing things. Being open to a change in paradigm does not indicate that a person thereafter ignores previous information or, to the extreme, stops using drugs to treat patients, but rather has more options and can use drugs within a framework of cognitive flexibility rather than blind obedience. I think most of us are aware that the entire process of medical education, from the education itself to the textbooks to postgraduate education, is highly influenced by the pharmaceutical industry. You can see that discussed here in an editorial published in The Lancet, and I've also provided of course, additional commentary and details. I would hope that by now most of us are aware that the medical journals are highly controlled and influenced by the pharmaceutical industry as well. And in fact, last year in 2019, I published an editorial on that topic written with Dr. Joe Pizzorno. Because of the heavy-handed influence of the pharmaceutical industry in education and in scientific publications, we of course then see that influence translated into how doctors think and practice clinically. So you'll notice that most doctors in clinical practice focus on the disease, the drug, the diagnosis, and the management, but they don't really think outside of that box into what actually might be causing the condition that their patient's presenting with. To think of what is causing a condition that a patient presents with is very different from thinking, what drug do I need to use in order to treat or alleviate this condition? So treating the cause, as we do in naturopathic medicine, is very different from asking oneself, how do I manage this condition and what drugs do I use to treat this condition? So what I'm going to show you in today's presentation is how we can shift that paradigm to focus more on the cause that we can correct, rather than thinking, how can we simply medicate these numbers and medicate these symptoms so that the condition is therefore, quote unquote, successfully managed. So let's look at some characteristics of the pharmacocentric medical paradigm. First of all, it is disease-centered and drug-centered. If a condition has no drug, it's usually ignored within so-called standardized or so-called conventional medicine. Thirdly, the medical paradigm, as most of us know, is very self-affirming. Drugs, surgery, radiation, and vaccination are the assumed or presumptive solutions to all health problems, regardless of their dangers, costs, inefficacy, or the existence of better options not taught in medical school and residency. Nutrition is belittled categorically, and that belittlement is not based on knowledge, but rather ignorance. I think we also know that the medical profession is also very exclusive in many ways, socially and conceptually. If a better solution is not a drug, then it is usually not considered a realistic solution. Again, nutrition is excluded categorically, even though nutritional therapy has been shown to provide benefit even for purely genetic disorders such as sickle cell anemia. Another aspect of the medical paradigm is that the ends justify the means. So this is what I call illogical proportionality. Serious diseases require serious, that is, expensive and risky treatments. And I think this model of ends justifying the means also accounts for some of the abusiveness that we see in medical education. Also within the medical paradigm is hierarchy of command and thinking, the deference to specialists, which of course at sometimes is highly appropriate. However, generally speaking, within medicine, most of the decisions are made by authoritative groups and published in major journals, and so doctors have to comply with the so-called standard of care and so-called approved treatments. So again, medicine is very hierarchical. It is decided upon by authoritative groups, implemented by physicians, and then followed by compliant patients and students. Very little deviation, very little customization, and very little independence of thought. And number 7, finally for this page, the medical paradigm is very fatalistic. When a person has a disease, the disease has the person, and fate is pretty much predictable and certain. So we say, for example, that a person has diabetes, and many articles, even in modern times, have been published saying that diabetes is irreversible and must be managed by drug therapy alone. In contrast, in the naturopathic and functional medicine paradigm, we see that